Good afternoon, everyone, and welcome. My name's Sarah Shaw, and I'm just really delighted to welcome you all to this event today. We're focused on the future of low-carbon health and care. So it's very fitting we're in a passive house at college, which for anyone who may not know is designed and built in line with an international building standard that's focused on creating affordable energy and heating, as well as comfortable and healthy buildings. And this really epitomises what we're here for today. So I'm standing here as just one of the organisers of this event. I'm based in the Department of Primary Healthcare here at the university, and my background is in sociology, social studies of technology and innovation, and applied health services research. I often work at the interface of policy and practice, and in recent years, I've growing interests in how we can bring about more environmentally sustainable healthcare. I'd like to acknowledge the rest of the organising team for this event, and it's very much a team. And it brings together all women, as you can see, with backgrounds, knowledge and expertise that stretches across disciplines. So we've got medicine, public health, medical sociology, geography, global health, and much more, actually, but also across organisations concerned with health and social care, as well as the wider environments and communities that we all live and work in. That we've come together to make this event happen is, we all think, really an indication of the urgent need for cross-disciplinary and cross-organisational action to urgently drive forward low-carbon health and care. And what we mean by that is to significantly reduce greenhouse gas emissions across the operations, supply chains, care pathways, and also the infrastructures that make up health and care systems, while also, of course, maintaining or improving equity, quality and resilience. And we're really delighted to see such a diverse audience in the room today. And I know some of you are from Oxfordshire, but also more widely, and from across health and care, from geography, from policy, from environmental studies, economics and more, and bringing a range of perspectives. And that really is what today is about. We all have different views on environmentally sensitive and low carbon or net zero health and care. And I'm sure much of this will come out in discussion today, or I hope it will. And we invite you to surface and explore those differences, but also to consider constructive ways forward. Now, I'm confident, I hope, I don't know the room, but I'm confident that we're all united in believing that we urgently need more emphasis on low carbon health and care. Surely, that's why we're in the room today. We know that the health and care sector in Oxfordshire, the UK and more widely contributes to climate change and is highly vulnerable to its effects. Making the sector more sustainable can help to protect people's health, both now and in the future. So my job here today, before I sit down, is to introduce the day and just set the scene for panel discussions. So on behalf of the organising committee, I'd like to just highlight 5 key themes that we can return to, debate or add to throughout the afternoon, and we're hoping for quite a lively discussion. Firstly, we know that health and care systems emit significant greenhouse gas emissions. We know more about health than care, with health systems globally responsible for around 4 to 5% of greenhouse gas emissions. And if we're serious about addressing climate change, this urgently needs reducing. I think we all know this, right? Progress is being made and policies are in place, or perhaps some policies are in some places. And there's a vision for climate resilient, low carbon health and care systems, but there is a significant way to go with many emissions hidden, for instance, in supply chains, in clinical waste, in travel, pharmaceuticals, and that's making reduction really, really challenging. Secondly, we know that climate change is already harming health, our health and the health of others, locally, regionally, but also globally. So extreme weather, worsening air quality, infectious disease spread, food and water insecurity, mental health burdens, they're all increasing, and I'm sure there's more. This places additional burdens onto health and care systems that then deal obviously with greater demand and more severe crises. Vulnerable populations such as the elderly or those on low income are particularly affected, raising questions about sustained and potentially widening inequalities, really concerning. And if health systems don't address their own emissions and environmental impacts, they contribute to the very problem that they're trying to solve. Third, I hope we're going to come up with some solutions after this as well. I don't want to be too depressing. But third, we need to ensure climate resilience and continuity of care. And resilience actually is already a word that's come up several times just in conversations before today. So hopefully we'll return to it. Health and care systems exposed to climate risks like flooding, power outages, supply chain disruptions, they may fail when it's needed most. So making climate systems resilient ensures they can continue to function under stress and provide the vital services and care that people need. Nearly there. Fourth, there are co-benefits here. Let's not forget that. So for health and care, but also potentially for economy and environment, and I'm sure more. We have systems and staff in the UK under significant stress, service users that can really struggle to access or navigate care, and there are significant financial challenges, and in fairness, there always are. Many of the measures that reduce emissions also improve health directly. For example, better air quality, fewer hospitalisations for asthma, right? Financial savings can be gained through energy efficiency, more efficient procurement, or waste production. Fifth, and finally, I'd just like to point to the moral and ethical responsibilities that we all have in this space. So health and care, as we all know, are founded on the principle of do no harm, but their contribution to climate harm via emissions is definitely undermining that. Also, given that those least responsible in the global south, for instance, but also those locally and typically the most vulnerable in our communities are often those most affected by environmental harms. And so there are issues here about equity and about justice. So I'll stop there, enough from me. I'm sure we'll return to some of these themes in the discussions that follow. Our programme for the rest of the afternoon involves two panels. So the first is deliberately interdisciplinary, inviting a breadth of perspectives and discussion on the journey to low carbon care. And across the committee, we did put a lot of thought into how we set up this afternoon. We then break for coffee. Again, a lot of thought in that as well. We all need a break before returning to a second panel discussion focused specifically on health and care, and inviting us all to take a close look at where we are now, but also where we want to be or where we need to be. So we invite you after that to join us afterwards for drinks and I'm assured canapes as well, but to network and just continue the conversation. And so I'll stop there. Thank you very much, all of you, for being here. And I now turn to our first panel and Juliet.
So I'll be chairing, I'm Juliet Carpenter, Director of Research at the Global Centre on Healthcare and Urbanisation here at Kellogg College, and I'll be chairing this first panel on interdisciplinary perspectives on the future of low carbon health and care systems. So I'd like to invite the three panellists, if you would, to come and join me here, and we can get going on the panel. So, as you like. Yeah. So, first of all, I'd like to introduce Laurence Wainwright, who's based at the Smith School of Enterprise and the Environment, where he is course director of the MSc in Sustainability, Enterprise and the Environment, and is a departmental lecturer in the Department of Geography. So, Laurence, over to you.
Thank you very much. It's a great pleasure to be with you this afternoon. Let's start by framing the nature of the problem that we are dealing with when we're speaking about climate change and we're speaking about sustainable healthcare. These are not linear problems that can be solved in a cause and effect manner. They cannot be solved with management. These are wicked problems. They are complex and nuanced in nature. They involve multiple different actors with multiple different interests. They require collective wisdom rather than individual genius. They require soft power and cooperation rather than hard power in competition. They require ultimately leadership. So we're thinking about wicked problems and we're thinking about tame problems. The challenges we are dealing with today are wicked by nature. They work on the dynamics of complex adaptive systems. And the beautiful thing about these systems is the same force that got us into the mess in the first place can also be used to help us get out of the mess. And the way we use this is through finding these sensitive intervention points within systems. These places where we can get disproportionate bang for buck. Where can we get a huge return making a minor tweak to the system? And I believe when we think about sustainable healthcare, climate change and care, there are places in these systems where we can get this disproportionate return. And I'm cautiously optimistic about this. So let's think about the role of business in all of this. I'm a great believer in the force of business as a cause for good. Business, though, is a great paradox. It's the cause of, but also the solution to many of these obligations, many of these great challenges we are dealing with. We start to ask questions around purpose. What is the purpose of business? To whom does business owe obligations? What are these obligations? What is a stakeholder to business? What objectives do stakeholders have, and how do they intersect with those of business? Should the obligation of business be to have a net positive impact in the world? Should it be to break even, to neither do nor harm nor good? Or is it okay if business has a net negative impact in the world, which is what we're mostly seeing at the moment? One of the questions I often start my lectures with is, if law is to justice as medicine is to health, as business is to what? And I think we don't know the answers to that at the moment. We're dealing with an identity crisis around what the purpose of business is. A company like Maersk, involved in significant amounts of supply chains in healthcare, is responsible for 0.5% of all emissions globally. That's one single company, 0.5% of all emissions globally. Think about that. If we have just 200 companies emitting that amount of carbon emissions, we have the entire amount captured within those businesses. So one single company. We started off talking about business ethics around morality. What are the moral obligations of business? We then moved towards corporate social responsibility, where profits actually, how profits are used. And we're now thankfully moving away from that. We're asking questions around how profits are earned, where are our revenues coming from, where are our profits coming from as a business. The last 3 years, I've been focusing on the intersection of two issues that I'm greatly passionate about, being climate change and extreme heat and mental health. The research that I've done has really been quite shocking. The impacts of extreme heat for the general population, increased rates of suicide attempts, declining cognitive function. We all know what it's like for processing speed, attention, memory when we're hot and bothered. Associated productivity. So a Lancet study from 2018 found that there's an average 2.6% productivity decline for every degree increase in temperature beyond 24 Celsius, the ambient temperature that someone has to work at. When I went down to Parliament to present these findings, they weren't interested in the mental health aspects. They were just interested in that productivity number. They wanted to know what the impacts on the net GDP of the UK were going to be if everyone was hot and bothered and not working productively. Now, for the 16% of the UK that live with a psychiatric illness, there are major problems. Worsening of side effects of many commonly prescribed psychiatric medications. Let's think about the SSRIs, the older tricyclic antidepressants, the monoamine oxidase inhibitors, antipsychotics, even psychostimulants, lithium as well, worsening of existing symptoms, manifestation of new symptoms. Excessive heat can occasionally act as a trigger in some conditions to a new phase, such as mania and bipolar. Increased rates of presentation and admission to hospital. The suicide numbers are quite alarming. So suicide risk doubles at 32 versus 22 Celsius. So I'll say that again, there's a doubling in suicide rates for those with a psychiatric illness at 32 versus 22 Celsius. And when we think about the UK having longer, drier, hotter summers, this is a big problem. There's impacts on things like sleep. We know what that means for those with psychiatric conditions. So I'd like to sort of pose this challenge for us today before we start. We need to stop seeing these issues as independent. They are interdependent, they are interconnected, they are overlapping. Sustainable healthcare, good healthcare is also about looking after climate change and taking care of these issues. So we must see them as interconnected. Thank you.
Great. That's great. Thanks very much for that sort of broad brush view of the context from the business and economics perspective. Thanks very much for that. Now we're going to move on to Dr. Martha Crockat, who is based at the Leverhulme Centre for Nature Recovery, which is part of the Environmental Change Institute, giving a perspective from nature.
Yes, great. So first of all, thanks very much for having me here. It's really interesting to be here because for most of my career, I've described myself as an ecologist. In recent years, I've moved more to thinking about people and nature after about a decade working in environmental NGOs with people. Now I find myself at the School of Geography and the Environment, where all three of the panellists are, strangely enough. So there's obviously, you know, good links here with health and care and sustainability. Yeah, and I'm currently doing research into equity of access to green infrastructure. So, yeah, there we go. So, green infrastructure. I imagine a lot of people here might know what it is, but let's just think about that for a moment. Green infrastructure is a multifunctional network of natural places and features. So that can be your back garden, it's the beautiful space we have around here, but it's also blue infrastructure. It's streams and the coast, it's hedgerows, it's parks, it's all these natural features, it's street trees, it's verges, all these things. And that network, and particularly the multifunctional nature of green infrastructure, is really important. Just hearing from Laurence about the impacts of heat, extreme heat, on mental health and other factors, you can start to see how cooling, having green infrastructure around which cools environments, could have a very positive impact on healthcare. And again, I probably don't need to tell you guys this, but let's just think, what are the benefits of having green infrastructure? Why does it matter to health? There are so many papers with so many details, I can't remember them all, but there's mounting evidence showing lots of positive benefits of living in and around green space. So for example, this review in 2020-21 found that living in greener places was associated with lower mortality and mental health disorders. Physical inactivity is lower, as are sleep disorders. It's more positive for body mass index. I could go on. And so there are these positive impacts of living in and around green space. And these are thought to be because these spaces allow things like physical activity, they provide a space for socialising and relaxation, and also they, as we've already said, they cool the natural environment, and they provide areas that are freer of noise pollution and air pollution. So yes, mental and physical health and well-being benefits of green space are really important, but it's not just the areas that we live in. There's also a multitude of studies showing that green space in and around healthcare settings, for example in hospitals, can have very positive impact. So there's that classic study from 1984 where they found that patients recovering from surgery in a hospital, when they could see a beautiful green view out their window, they recover more quickly. And more recently, there was this amazing study showing that children who had just a little dish garden in their room, they had better health outcomes. So just that tiny bit of green space. There's also, like on the wider estate, there's some evidence showing that people visiting family members in intensive care units feel more relaxed if they can have their away time in a green space than in a cafe or other indoor space. So lots of benefits of green space to do with health. Unfortunately, not everyone has access to these benefits of green infrastructure. And Raymond Fennell, who owned White & Woods, the university estate, back in the 1930s, he knew this. In the 1930s, he was bussing out the impoverished children from grey Cowley out to White & Woods to get fresh air and exercise. And people weren't doing detailed studies about the benefits of green infrastructure at the time, but it was instinctively understood that there can be benefits to being outdoors. And this is the research that I've been doing recently. In Oxfordshire, we have areas that are very socioeconomically deprived and have less access to green space than more affluent areas. And unfortunately, these socioeconomically deprived areas are also associated with poorer health outcomes, a whole raft of socioeconomic deprivation is associated with all sorts of, there's health inequalities. We know that the health benefits of green infrastructure are actually greater in more deprived areas. So the people who need green space most, actually, not only do they often have the least of it, but they also need it more than other people. So green infrastructure has a really important role to play in health, in addressing health inequalities. But also, as we've spoken about a bit, it can support the health and care system in reducing the carbon footprint. In a small way, I understand that buildings in the NHS estate are responsible for 10% of carbon emissions. You can have things like green walls, well-planned green infrastructure that can help cool buildings. But I think a bigger impact can be around through having better health in green spaces in and around the places that we live. You're reducing the need for people to access healthcare in the first place. And so you're cutting down on medication, doctor's visits. And of course, once people are in the health or care system, if you've got more green infrastructure around, there is some evidence showing that you can be there for less time. You're going to have better health outcomes, perhaps in a shorter period of time. So I think overall, I'm really interested to hear what you guys think about the role of green infrastructure in this issue of reducing the carbon footprint.
Great, thanks very much for bringing an ecologist's perspective to the debates. I'm sure there'll be lots of questions afterwards in relation to that. And lastly from the panel we have Dr. Jennie Middleton, who is Associate Professor in Human Geography at the Transport Studies Unit, and bringing a sort of travel and mobilities perspective to the debate.
Thank you. And first of all, thanks to Juliet and colleagues for the invitation today to join this panel and for everyone being here. So a bit of the title of this panel is Journeys to Low Carbon Futures, and it's very much the journey aspect that will inform the few things I want to talk about today. Okay, so in terms of point of departure, so a couple of summers ago, I was in the audience of a panel organised by a local transport group about the future of transport in Oxford. Now, there was lots of chat, as you can imagine, about LTNs, about cycling safety, bus fares, but it was the comment of one particular city councillor that stuck in my mind. So when he was pressed about measures to stop parents driving their children to school, he began his response with this question: what could be nicer than walking your child to school? And what I want to suggest today is that there are many assumptions embedded in this question, and that walking and active travel more generally as something to endure rather than enjoy receives far less attention. So certainly in the context of low carbon mobility such as walking and cycling in much of the global north, including the UK, the focus is very much on improving the design of streets and things like pedestrian signage. So the common theme is you get the built environment and the quality of information right, and people will make more sustainable transport decisions and walk or cycle. Yet what continues to cut across much of this promotion of things such as walking and cycling is very little account of people's differentiated experiences. So often it's a non-disabled, unencumbered, white, adult male body that's frequently assumed in a lot of this promotion. And what I want to argue today is that it's important that we continue challenging these assumptions, and that not all experiences of walking and active travel more broadly are the same. Furthermore, walking and cycling, but walking is where a lot of the work that I've done sort of historically, it isn't always something to enjoy, especially when we consider wider lived experiences of urban inequalities, as my next short example will hopefully illustrate. So in December 2019, Channel 4, the UK broadcaster, screened a documentary that provided a devastating window onto the lives of over 4 million children living in poverty in the UK. Now, one of the families that featured in this documentary were Courtney, who was 8, her 6-year-old brother, and their mother. They were living in a 3-bedroom flat in Cambridge, having fled domestic abuse, yet were having to move to another part of the country as they could no longer afford the rent due to the bedroom tax being levied on a third unnecessary bedroom. Of the many disturbing scenes throughout this broadcast of children enduring the contemporary equivalents of Dickensian Britain, there's one in particular that's stuck in my mind that's of relevance to the point I want to make today. So we see Courtney, her younger brother and mum visiting a local food bank for the first time, and this is about 4 kilometres from their home. They're filmed walking there and back in the early evening darkness as they couldn't afford the bus fare due to delays in universal credit payments. As I watch these young children struggle to carry the heavy shopping bags of provision from the food bank on this journey back to their flat, I wondered what difference would a well-designed, walkable, high-quality, pedestrian-friendly public realm have made to their experiences. And the conclusion I quickly came to was very little. Now, these romanticised ways of thinking about walking and its health and environmental benefits also sit in stark contrast when we look to other parts of the globe. For example, walking and cycling in many African cities is not just uncomfortable, it's deadly. There are approximately 261 pedestrians and 18 cyclists killed every single day. So the point I want to make today is that who we are and how we move are really important. Our moving bodies matter. And when we pay more attention to this, what I'll call the politics of low carbon mobilities, such as walking and cycling, what also emerges is the labour and arduous nature of this for so many people. And I want to finish by just flagging a project that I'm leading at the moment called Care on the Move. So this is a UKRI funded project. There's myself, Anna Plushdeva, Haifa Al-Arasi and Daniel Munoz, a colleague based in Santiago. And this is against a backdrop of over 1.5 million children in England who have special educational needs and disabilities. Yet you've got most of you will be aware of these sorts of headlines that are across the media at the moment, but there's very little work on the everyday mobility experiences of children and their families living with SEN. Now, in this context, what our project Care on the Move is examining are the barriers to everyday mobility in considering the physical, emotional and logistical labour involved in what it is to care on the move. And more specifically, how transport agendas, particularly those hoping to encourage walking and cycling, might be reshaped in response to the needs of children with SEND and their families. And now for us, care is central to these concerns. I can talk about this in the discussion should you be interested, but we're working with local partner organisations in Swindon and Oxford, and then 25 families across each of these localities. Here you can see the interview kits we use with people. I mean, again, I can talk about this in the discussion or over coffee if you're interested. What this kit in our interviews has enabled is for families to more easily speak about the exhausting, invisible labour involved in moving in the first place, let alone even contemplating moving in sustainable ways, but the labour. And I think this next slide of the kit really highlights that. So here are some transport modes, and these are magnets that are used to support some of these conversations. And then here you can see all the other things. I mean, those of you, the children in the room, some of these things are relevant there, but the impact of not considering some of these things to how these families move is quite significant. So just to close, I want to conclude with a couple of questions, or at least pose them as a challenge, or maybe an alternative understanding to the more romanticised versions of how we think about low carbon mobility, such as walking and cycling. So why do romanticised ideals of walking and active travel more generally dominate urban imaginaries across a range of different spheres? And also, what might be gained by beginning with the less celebratory and frequently laborious nature of low carbon mobilities? And hopefully these questions will make visible some of the pressing need and the brief things I've spoken about today for more inclusive ways of how we think about low carbon futures. I'll finish there. Thanks.
Thanks very much, Jennie. Really interesting to think of active travel from alternative perspectives, and I'm sure there'll be some questions and discussion about that. So now what I'd like to do is really turn it over to you, the audience. What we're here, we're not here to to give you long lectures about our perspectives on low carbon health and care systems. What we really want to do is engage with you and to hear your perspectives. I think we've got people in the room from very different disciplinary and research backgrounds, and it would be great to hear some of your responses to the three presentations we've heard in this panel. So I wonder if anyone would like to kick off.
Hi, I'm Pete Sudbury. I'm recently stopped being the Cabinet Member for Climate Change, Environment and Future Generations on Oxfordshire County Council. Jennie, I loved your talk. I thought that was fantastic, challenging that sort of romanticised active travel. As part of my portfolio, I shadowed transport, and there are the idealists around active travel say, yes, just stop people using cars and everything will be fine. I live in the countryside. I live in Woodcote, and yeah, there are 2 buses an hour if you happen to want to go. No, 3 buses an hour if you want to go north or south. East and west is more of a problem, and you don't get any sense that anyone gets that actually in many places car dependence is real, and short of a massive revolution in the way we do things, which probably is needed, it won't go away. And the great story, actually, somebody talking about wanting to bypass a village so that people can walk and cycle without getting run over by cars mounting pavements and stuff. And everyone saying, no, you can't build a road. It's awful. That just makes more traffic. And one of them said, I said, well, and all the people who do this, they live in the middle of Oxford. They're armchair warriors. They live in the middle of Oxford, and all of the plans around Oxford require a ring road. And you say that, and they say, yeah, but if you had to build it, I wouldn't let you. It really is. We really do need to challenge that. We need to be. What is the best way for people to get places? Yes, it's great if we can make it easy to walk and cycle, but walking and cycling doesn't answer the problems, particularly for people who are time poor. The other thing is all transport planners are men, and so they all have men journeys. Man get in car, go to work. End of day, man get in car, come back from work. Not woman get in car, go to drop children off, go to work, then goes to see sick mum, comes back to get the children, does the shopping. That would take you about a week on public transport. And really, we have to rethink the way we do this. But I thought it was great, really brilliant.
I mean, thank you for your comments. I mean, I think the one thing that I should also caveat that this isn't an anti-walking or cycling, these things are really important, and low carbon mobilities and low carbon futures are really important. But I think understanding people's lived experiences and having those as part of the sort of wider discussions is really, really important. And a lot of those sort of voices are missing from these debates that are happening with too few people. And actually the families that we're working with, they haven't got time to go along to a panel on the future of transport in Oxford. That's the last thing on their mind. But also being told again and again that you are a bad person for getting in a car because you can't actually get your child to walk down the street in the first place isn't the answer either. So there's something I think quite important about changing the language. Interestingly, we work with, on our advisory committee, we have Living Streets, who used to be the Pedestrians Association formerly, and they obviously do a lot of work around promoting walking. And they've actually stopped using the term active travel recently, and use it because it can be quite an exclusionary term, however inclusive you try and make the term active travel. And maybe there is something about changing the language about how we talk about these things in the first place.
I ought to say I introduced the 20 mile an hour programme, and I also am fanatically in favour of LTNs and everything else. I'm just in favour of them for everybody, and accept that that you can't not drive sometimes.
Is there a question over here?
It's a comment and a question. So I see the difficulties from the perspective of the SEND families. I should introduce myself. Sorry, I'm Chris Pugh. I was Sustainability Fellow at Kellogg College, but I retire next Tuesday, so I'm not anymore. And I'm delighted this is taking place. But in the healthcare setting, there's a wider issue. In some ways, the people who would benefit most from increasing their activity are the sickest amongst our patients. But equally, the ability to access healthcare is most difficult for them. And I'm going to tell you an ironic local story relating to the Churchill Hospital, which is where I used to work on the renal unit. So the hospital, in its greater wisdom, decided to have a district heating system installed, linking the John Radcliffe and the Churchill. The consequence of that was to dig up the car park outside the renal unit. The consequence of that was that all the patients coming to my outpatient clinic had to walk about half a mile across the Churchill Hospital to get to the clinic room. The reality of that was that the patients who arrived in my clinic really didn't need to see me. And the people who did need to see me were the people stuck halfway down the corridor between the car park on the far side of the hospital and where I was working. So I think it's an interesting example of the whole system trying to do something good, creating a whole set of problems, and then leading into these issues around who benefits, who can manage it, who can't manage it, etc. The irony is we were sent a registrar to see if the sick patients and the consultants just sat in their clinic rooms waiting to see what happened. I'm being a bit tongue-in-cheek there. Anyway, some observations. I hope they stir up some interest.
Any other questions at this point? Yeah, at the back there.
Thank you very much. This is a question for Martha, actually. I've looked at your maps before, and they're incredibly helpful in terms of determining access to green space. And I guess my question is, how is that evidence being used by local communities or by the universities to reflect on who owns the private land that's inaccessible, and how do you make it so?
Oh, that's a really interesting question. Who owns the private land? I think looking at the maps that we've created, and what Soren's referring to is I showed one image in my short presentation. I looked at neighbourhoods in Oxfordshire that are socioeconomically deprived and lack access to green space, and highlighted neighbourhoods that should potentially be prioritised. We haven't specifically looked at private land, but looking at the maps and seeing the percentage of private green space compared to public green space is quite stark. So I think across Oxfordshire, it's a tenth of our green space. This is excluding agricultural land, is open to the general public. That does exclude footpaths that go through private woodland and so on, but there is a vast amount of green infrastructure, green space around that people don't have access to. And yeah, some of it's in urban areas, some of it's in rural areas. And just talking about travel, of course, people face very different issues accessing green space in urban and rural environments. But yeah, I think there is a lot of potential for opening up more green space in creative ways so that, yeah, people have more access to it.
Thank you so much, all of you. Just really interesting. Can I just ask you all a question, going back to your point, Laurence, then about business, and just picking up on the question about private enterprise as well. What is the role of business here? And what is the role of kind of other money outside of the public sector to really help us shift towards low carbon health and care future? Because it strikes me there are potential issues all round, and they're a little bit hidden under the surface at the moment.
It's such a wonderful question. And, as I said during my talk, I'm a big believer in the power of business. I think it's an enormous force of destruction, but it can also be an enormous force for good. If we yield the power of markets, of economics, of business, of human nature, of the profit motive, we can do enormous amounts of good. I mean, I think this question around, purpose, identity, mission, vision is really essential to what we're doing at the moment. And we're asking these questions, Amy and I are going to Novo Nordisk and saying, what's your purpose as a company? Is it to, cure diabetes and obesity? Is it to do something else? I mean, but I think it's back to this point around, do no harm, break even, have a net negative impact in the world, or have a net positive impact. And I think we're actually asking companies now, you need to not only offset the mess that you've caused, but you actually need to do something good about it. And you need to move beyond looking at where your profits have actually, how your profits are being used, and philanthropy and giving money away, to how profits are actually being earned. And again, with the Maersk example, this is one little Danish company emitting 0.5% of all emissions globally. If we get these companies get their act together, get the fossil fuel majors, we take away these subsidies from fossil fuels that are so problematic around the world, I think we can pull this off. And I think business, it's obviously there's consumers, there's government, there's business, there's NGOs, but I think business really holds the key to all of this. So.
I mean, in my own work, actually, it's funny. I was in a meeting just before lunch about our engagement with business, and there's something that we don't necessarily do very much of in the sort of the research group I work in. So I don't feel very qualified to answer that question. So I'll hand over to Martha. But it's something to think about, I think.
Yeah, I think also for me, something to think about. I could waffle, but I'm going to try not to waffle on. But I think, I think there's a huge role for private companies. And what immediately springs to my mind at the moment is with the planning and infrastructure bill. There's big changes proposed, and what I see is we need more houses. Of course, we need more new houses. But I see developments going through and private companies pushing for sort of like the minimum in terms of green infrastructure and creating communities, and having been given increasing licence from the government actually with the changes to scrutiny on planning proposals. Having licence to create communities that are probably less livable, where we've got real opportunity to make livable communities that include green space and other elements that make them good for health and places to live, and we're not taking that opportunity. So I think that's very short-sighted, and that's not necessarily the company's fault. As you say, I think obviously business has a huge potential for positive impacts as well, but that's just what springs to mind at the moment, unfortunately, when I think about businesses and impacts on green infrastructure and health.
Great, thanks very much. I wonder if I could just jump in with a question, something that seems to be emerging from some of the talks and the questions, is these sort of conflicts, the tensions and the trade-offs that we're facing in terms of net zero and trying to build towards a sort of decarbonised society, and exactly those sort of inequalities and how different social groups are living this sort of journey to low carbon differently. And I wondered, from your disciplinary perspective, it's not perhaps a question that's got an easy answer, but how can we ensure that decarbonisation efforts don't exacerbate these inequalities, not only health inequalities, but also these wider societal inequalities that, were very clear from what you were saying, and also from some of the things that came out in all the presentations. So I don't know whether...
certainly. I can talk through this through the Care on the Move project, but the project advisory panel we have is made up of a few academics, but also members of the charities we're working with, and Living Streets, and a number of others. But a couple of the parents who are parent representatives from Sendias and Swindon Sen Family Voices. We were at a workshop a couple of weeks ago, and we sort of asked them this question about, well, what is the answer? How can your lives be improved in terms of how you get around? And again, we're very clear with the parents, this isn't about trying to push a sort of sustainability, low carbon agenda onto them. It's trying to understand their experiences. And this quote really stuck in my mind, because one of the parents who's been involved in this organisation for a very long time, she said, they think they know what's best for us without knowing anything about our lives. And I think this goes back to some of this research that we're trying to do, is trying to make visible some of people's lives. And I think the broader point I've made in some of the work I've done on walking in the city is that, as I said, these things you know, in terms of altering the built environment, building more cycle lanes, doing whatever these infrastructure things are meaningless until we understand the complexities of people's everyday lives. And that's where I think some of the resource needs to go in to funding that sort of in-depth understanding of the complexities of how different groups are living in our cities and beyond.
I don't know if either of you would like to come back on that.
Yeah, look, I think it's a superb question, and in many ways it's the reason we're here today. And I think the first step is being realistic rather than idealistic, and acknowledging that multiple different groups and actors in life have multiple different interests, and you can't always reconcile these smoothly. I think the first step is getting the different voices to the table and making sure that there's representation of all the voices that need to be there, sitting down and saying, what matters to you? What matters to us? What are we trying to do? What are you trying to do? Where are our shared values? Where can we find shared value creation between both of us? Those places where your interests and my interests overlap. Where can we find these genuine win-wins? Not magical, hopeful win-wins, actually authentic, genuine win-wins. Where can everyone at the table increase the size of the pie rather than just increase the slice that I get and make this a zero-sum game? I like to look at the Nordic countries, Sweden, Norway, Denmark, Finland and Iceland, in my mind, as being some of the most sophisticated societies in the world in the way that they think about sustainability, they think about healthcare, they think about society. And I think these countries are getting closer than anyone to actually mastering these sorts of questions. And I think the way they do this is through soft power, through cooperation rather than competition, through a nurturing, more authentic society that represents different voices rather than this sort of cutthroat, totalitarian, I win, you lose view of things. So yes, I think it's a matter of getting the voices to the table, finding shared value and being realistic rather than idealistic about what's possible.
Great, thanks very much. Martha?
Yes, and there's a well-known issue with changing cities, that gentrification thing, and there's a whole raft of papers about green gentrification. There's one paper that I paraphrase the title, but it's something like, how can you make a neighbourhood just green enough so it doesn't start, so that people with more money don't come in and say, right, I want to live there, and you get the people who've lived there already having to move out, being priced out of the local market. And I think the thing these guys have been talking about as well, about hearing different voices, is really important. And we've done some of that in my work in Oxfordshire. So I was working with a master's student who was doing walked interviews with people in a very deprived area of Oxfordshire, a sort of intermediate area and a more affluent part of Oxford. And it was, of course, one thing that came out was not just that people experience green space and accessing green space differently, but also that how people felt their voices were represented, their ability to have their voices represented in decisions made about these spaces varied a lot. So, and just like I was saying, that some people, that there are all these send voices, people that aren't being heard, I think as well in how green spaces are planned and used. There's a whole raft of voices that aren't being heard because people planning aren't taking into account, it's difficult to take into account that people have very different work hours. And if you have set work hours and you can't work from home, like I know that if I want to work from home so that I can take an hour and go to a meeting at lunchtime, I could. There's plenty of people who can't, perhaps people who work in more lower income jobs who have to be at a certain place in certain times. They can't access the decision-making powers about green infrastructure. And I'm sure that's the same for transport. Yeah.
And I'd just add to that, I think there's something about getting the voices to the table, but one of the issues is how, who and how. They can see the kit there and it looks quite simple, but we spent, and when I say hours and hours, I mean hours and hours devising this kit as a way that we really thought carefully about how we engage these families, so it didn't put unnecessary additional labour onto them as being part of their. So we spent a long time thinking about, okay, how do we involve people in the research process? How do we not add to the burden of their lives down to and there were points where I thought, actually, is this overkill? Are we paying too much attention to the very minutiae detail? And actually, some of the feedback from the participants was, well, this was great because you'd really thought about how, you know, down to the texture of the magnets. And then this is a kit that we leave with the families to support the children in transitions. And so there are pens as well, and they can use that as a way of transitions. Those of you that have SEND children maybe in this room, transitions are a real issue. So we thought if we can leave a sort of, I mean, we paid people as well. But if we leave this kit with them, it's something of value. And we've had feedback from participants who found this a really useful tool in moving with their children. So I think there's something about the methods that we use to engage people and thinking really, there's a geographer at Manchester called Saskia Warren who talks, and she did a lot of walking interviews with Muslim women in Birmingham. And she talks about the demand of the method, and it's all very well saying, right, we'll do a walking interview, but what does that impose on the participant? And then of course you have this issue of where you only have a small minority of voices within that who are able to participate in these bits of research in the first place. So I think there's something really important about, we call them careful methods, and the methods that we use with people to get voices and get people, you know, round the table.
Yeah, this, I mean, comes to mind the work that I've been doing with Alison Chisholm on listening exchanges, and trying to encourage people to listen to the other side, and it's in the context of low traffic neighbourhoods, having people from one person from either side of the debate to actually be in a room and have a facilitated listening session. One person sits quietly while the other one answers a question, and then that person repeats back what they've heard. And it's really understanding the lived experience of people who have a very, very different life to them, and a very different rhythm of their day, and really trying to understand other people's perspectives on these controversial issues. And it really was quite enlightening, I think, for people taking part in the listening exchanges on either side to really have an in-depth understanding of what it's like to live with a low traffic neighbourhood. You know, those who think it's good, and those who think it really is, you know, a barrier to how they can get around and live the lives that they need to. So yeah, all for voices and listening and understanding lived experience, I think, is really critical in these sustainability debates. Yeah, there's a question over here.
That's brilliant. Really, really interesting discussion, and I enjoyed each of the presentations so much. Sorry, I should introduce myself. I'm Louisa Chensner. I'm a public health doctor and a junior research fellow at the Centre for Personalised Medicine. And I feel that you've each mentioned, you know, such important kind of domains and factors, you know, transport, business, the natural world, that are deeply relevant to the health and care system, but they're not always prioritised or even necessarily considered by decision makers within that system. And I just wondered if I could ask, how do you feel that you can influence those decision makers within the system to take these areas seriously, and in particular to think about them in a sensitive way where we're thinking about the inequalities implications and making sure that they are being addressed and not just thought about in an abstract fashion, you know, in a report that sits on a shelf? I'd be very interested to hear your thoughts.
So for me, like the work that I've been doing has all been with local councils, speaking to local councils who know where the issues are. I think the research that I've done is all inspired by on the ground need. And so perhaps it makes me a bit lazy, because I feel like, because I'm working with these guys, you know, with people who are wanting to make a difference to green infrastructure and identify neighbourhoods that are most in need of it, I don't think too much about what I do with the research. I'm sort of handing it to the people who I know will use it. But having said that as well, it's always like the work that I do is 100% desk-based. And that says nothing about the lived experience on the ground. So at the moment, we're developing a methodology that will help other councils around the country sort of look for priority neighbourhoods that should be prioritised for green infrastructure improvements according to need, including socioeconomic need and other factors. And it has to be really impressed on people that it's like this is a starting point to perhaps even just to start conversations, to focus, because what's on the ground and how people actually use that space is going to be very different. It's like, you know, to use a very unflattering analogy, you can take a horse to water, but you can't make it drink. You can have all the green space in the world, it doesn't mean people are using it. So that on the ground knowledge and local, hearing those voices is really important. So I'm trying to make that part of the outputs that I create.
Would either of you like to?
Yeah, look, I think just very quickly, you know, there's no silver bullet here. It's a matter of getting these different forces for good and evil to the table. Business need to speak to government, just as government needs to speak to business. NGOs need to speak to consumers. Consumers need to speak to NGOs. We need to get these different entities talking to one another, understanding what harms and what goods they're causing and what they can actually be doing about them. We need to have these cross-stakeholder conversations, as I mentioned, and try and find these areas of shared value. Where does your world intersect with mine? Where does mine intersect with yours? What can we do about it? I think left to its own devices, business can fall away pretty quickly and get away with some pretty bad things. We need to have appropriate legislation in place. We need to have the courts. We're seeing a lot of very interesting court cases at the moment around climate change litigation, cases taking place. My colleague Tom Vetzer is a world-leading researcher on that particular topic. So business needs to be regulated appropriately, and it needs to be talking to other entities.
Great, thanks.
And I mean, it's something that with this particular project, we're grappling with quite a lot at the moment. We're in the middle of the project and we're about to sort of move into the final sort of data analysis, and we're starting to think about public engagement and obviously what we do with that. And we're working actually with a design consultancy called the Liminal Space, who often translate academic research into sort of, you know, visually appealing and sort of aesthetically appealing installations. So we're at the very early stages of developing what we're calling a sort of a mobile exhibition that is sort of modular, and we can sort of tour it around different spaces and places. Some of those will be sort of policy spheres. We've fed into various sort of government information, finding things around the autism committee, I think it was called. But again, I think one of the challenges is certainly with our participants is sort of managing expectations, in that, you know, as you say, you can have all this, but we're not necessarily going to change with what we're doing. It's about getting their voices heard and their stories out there. But in terms of what we're actually able to do with this project, you know, it's not, well, we'll see, I think it's about being realistic. But I think there is something really important about maybe sort of trying to feed into changing the narrative. And certainly with the government at the moment and all the cuts around send transport, it's very much on government agendas at the moment, thinking about transport and, you know, send children and how they get to education. So again, I think if we can sort of hook into some of those conversations, but we're there. And I think from the beginning with this project, we were very keen to get different people around the table, and that's been embedded from the beginning in terms of how we've thought about even how we develop the kit. So I think, yeah, watch this space, I think is what I'm saying.
Was there a question around? Oh, yeah.
Yeah, I've just been thinking about Martha's thing about just green enough. And a few years ago, I managed to get hold of Sarah Henderson, who was Public Health Director in British Columbia, to talk about the heat dome there and what happened. And after 3 days, the death rate in everyone over 55 went up by about 80% and stayed up for the whole heat dome. And one of the big modifiers was if you live near a tree. Every 10% increase in tree cover reduces death rates by about 10%. We can talk a lot about health benefits. There is something about death that is a very easy to count number, and it's also something that threatens actually decision makers. Decision makers are mostly over 55, and so actually we do have a group there with perhaps more traction, saying it's people like you who die. Oh, and people die in their own homes. They die in their own homes because over 3 days the temperature in your house rises. It doesn't go down at night because the night is hot, and by about day 3 it gets to the stage where it cooks you. And I do think we should get a lot more militant about 30% or 40% tree cover is not just a nice to have. It's actually a vital. It's vital. Trees, in fact, our tree policy, after a lot of work from me, says trees are vital climate infrastructure. We actually need to get them in for that reason. And that means we should be putting them in the poorest places first. And actually, the co-benefits are great because they help with flooding, they help with wind, they help with air quality, all the other things. But it is probably we should concentrate on death and death in decision makers.
I really like that that leverage point. I will definitely remember that. And you're right, because I mean, in all of this, we all know that evidence doesn't change what people do. It's storytelling and making it personal. So that's a really interesting one. Thanks.
Yeah, I'm going to pick up on that because I have the mic. Can you hear me? There was a really, just picking up on that storytelling and the language that we use, which you mentioned a few times, was a really nice report from Climate Outreach. Their latest Britain Talks Climate and Nature came out last week. And actually, so they look at sort of messaging that lands across different sectors of society. So dividing people up into their sort of priorities and political alliances and things. And when they're talking about climate and nature, actually, the one thing they found to be unifying there was nature, not climate change and reducing carbon footprints. And, you know, our event today is focusing on low carbon care, but I just would be interested on your thoughts as whether we're talking using the right language with people in terms of meeting a priority that works for everybody, or whether actually, you know, thinking about nature and the natural environment and our access to that is maybe a stronger landing point than talking about reducing carbon.
Yeah, I mean, it's funny because with my research, I haven't really thought about it in terms of carbon until this event at all. You know, I do. It's for me, it's about green infrastructure and making sure that people have access to it, and health is a sort of the background for it. But yeah, I remember, I can't remember who I was talking to, but I have heard that somebody told me that in their Twitter posts, they try and avoid controversial words like climate change. And that, you know, very much in my own bubble, but I think you're right. And we've said about finding commonalities, Laurence, you were saying, and I think that's so true. Finding something positive that people agree on, I think is a strong way to move things forwards.
I'll just reflect an insight from planning the meeting in that we initially had net zero in the title of today's event and took that out because it was becoming very politicised and we were not sure it was the right phrase to use. So it sort of goes back to that same issue, really.
I think it's a really important point, and that report, I think, really sort of is a good example of that. And certainly, you know, we've been thinking quite a lot about this in relation to, because we're in this public engagement phase, and we're like, you know, in the title for the funder, for the Economic and Social Research Council, it says active travel. And we're like, well, active travel, it's not in any of the interviews. It's not talked about in that way. So I think there is some, and you know, certain low carbon mobilities is something that we, you know, in the Transport Studies Unit, we talk about a lot. And actually it's not, in terms of how that translates beyond certain spheres, it doesn't. And so this issue of translation, I think, is really, really important of how these terms are. So I think, you know, language is important, and it's, you know, how we frame these things really matters. And, you know, some of these things are just immediately people are like, well, that I can't engage with that. I either don't understand it, or I'm not interested in it, or that's not a priority for me. Whereas actually this is a priority for me, even though that's probably relating to much of those issues. So I think, and also going back to Laurence's point about the interrelated nature of these things, it's so important to join these conversations up, because so often they're happening in silos. You know, I think one of the examples that I've sort of been thinking through reading some of our data over the last few weeks is that, I mean, I'll say the data is really, really, some of it's harrowing in terms of what these families are living through in their day-to-day lives. And a child's meltdown, for example, trying to get to school on time, leaving the house, or whatever that is, the ripples of that go far beyond the family. The ripples of that can be to the school, to other children, because then that child arrives at school utterly dysregulated, then dysregulates all the other children, classrooms can be evacuated, so the ripple, and then, the parent who might have to go off to work arrives at work and so the sibling who goes to another school then is disrupted because they've had such, and that's all down to things that happen on the journeys or something that the journey might have gone wrong. So I think there's something about connecting all these things together. For us, it's not just about transport, it's about so much more than transport, and thinking about these things, how they interrelate, is really important. And I think it's going to be a real key message from when we're engaging with policymakers about this is not just about send transport, this is about so much more, and it's only by understanding these lived experiences that will make these things visible.
Sure, yeah. Just to go back to your comments first, I think it's interesting in the UK, we have a minimum safe working temperature, but we don't have a maximum safe working temperature. And I think that's going to be a big issue going forward. To your question, I think it's a really good one. Business has an obsession with climate at the moment. And I think one of the reasons it does is because it's fairly neat and tidy to measure. We can get first, second, third scope emissions. We can measure them fairly accurately. But when we think about impacts on biodiversity, we think about soil degradation, we think about overfishing, all of these other issues, it's much harder to measure. How can we say a steel manufacturer in the Ruhr region in Germany, what is the factory's impact on the population of fire salamanders? We have absolutely no idea. There's no way of measuring that. Whereas we can actually fairly accurately capture its carbon emissions. And we need to start seeing these issues as being interrelated. The conversation, I believe, at the moment is being dominated by climate, which is a good thing. And this is fairly controversial to say, but I think what's going to get us before climate change is actually biodiversity collapse. I've got pet frogs and turtles at home, and what I know from those ecosystems is if you change the dynamics very slightly, the whole thing can fall apart very, very quickly. And I believe that we're pulling pieces of the Jenga tower out at the moment, blindfolded, and we're hoping for the best. And I think there's going to be a pretty bleak future ahead of us if we don't get a handle on rapid extinction rates. So we need to see these issues as well as climate change.
I was actually thinking that when I said hadn't thought about the work I've been doing in a climate perspective, but like the green infrastructure, like the importance of nature, it goes so much beyond like one person, a cohort's mental health issues. It's like it underpins life as we know it. And although urban green infrastructure is a small component of that, it's representative of this much larger biodiversity crisis issue. And it is the place where the majority of people, certainly in the UK, 84% of people live in urban areas. It's, the local green spaces are where most people have contact with nature, and not only for short-term and health issues, but for that nature connection, thinking about the bigger picture and, humanity's health, if you want to put it that way, they're very important.
Yeah, got a question here.
Hi, I'm Franco Gonzalez. I'm carbon analyst at the Oxfordshire County Council. And whilst I focus on carbon and reporting methodologies, we are expanding onto sustainability, broader sustainability scope. Pete Sudbury knows very well our work because he was part of our team. One of the areas that we are working, I think it captures very well, is donut economics. Is a framework that entices us to work in finding all the synergies across all these dimensions and finding all the interdisciplinarity and all the dynamics between all these areas, because we tend to think in silos. One of the aspects that we're working is and we hopefully will see the ray of light in, is a framework for decision making based on donut economics. but I guess that we are, well, we're talking here to the converted, right? Is one of the challenges that we face, and that's both externally and internally, is how to communicate these ideas of interdisciplinarity and interrelations between all these dimensions across organizations. And I think is how we start this, because it's part of the change management. And well, donut economics is a framework. It's been increasingly dominant, but there's a hugely dominant framework about the economy and growth, and as the only metric for decision making. Maybe the discussion about links with the business, the role of business, and from my perspective, it's also an important aspect, because we're also in charge of decarbonizing the supply chain, and we need to deal with businesses as part of our procurement to provide all the services across Oxfordshire.
Thank you for your observations and reflections. So Kate Rayworth, the founder of Donut Economics, teaches my MSc students. So I think that in itself is a sign of optimism that these students are going to go out there in the world and do something productive with this. Donut Economics is loosely based on planetary boundaries, the model by Rockstrom et al., also the SDGs, and reconciling these two together and saying we have these 9 planetary boundaries, we have these SDGs within them. How do we make sense of the different competing social, economic, environmental needs of humanity? And I think it's difficult. I think the SDGs are a good attempt. We had the Millennium Development Goals that didn't go so well, and we have the SDGs now, and we're not really on track to achieve the targets. But I think we need these to-do lists. We need these interdisciplinary to-do lists that we bring to the table, and we need to promote them. We're falling short, but we need to strive to do something. And I think the planetary boundaries model, donut economics, SDGs do a fairly good job in capturing this bigger picture perspective. So,
any other responses there? No, it's fine. I'm just coming back to some of these sort of more intractable questions that I've sort of going to throw out. Just this idea that, so we've got carbon reduction, we've got biodiversity and trying to support biodiversity, the two sort of aspects that we're talking about. How can we balance those needs with improving health and care systems, and that in terms of the quality, equity and access, which were 3 things that Sarah talked about in her opening introductions, if you like. I mean, that in a way that sort of underpins a bit what we're trying to do, trying to think about how to improve quality, equity and access to health and care, but also balancing this need to decarbonise and support biodiversity and divert away from sort of nature breakdown.
I think I'd go back to the point that I've been making about the importance of understanding the complexity of people's lives as the starting point, rather than knowing what the sort of the issues are from sort of all the data we've got on, which is really horrifying data around climate change and carbon and all the associated issues. But I think we need to start with the lived experiences and situate those with it. And as I said, the quote from the mother about they think they know what's best for us without knowing our lives, I think that transcends beyond just SEN families. That any group, I think that's relevant. So I think for me there's definitely something about thinking about those lived experiences and using them as a starting point rather than an add-on.
Yeah, I think in the second panel, I think it'd be interesting to pick that up and think about how that can happen within health and care systems sort of going forward. But I don't know if you've got...
Well, I was thinking, of course, that there's the individual decision makers at the end of, people who are deciding what brand of baked beans to buy and whether they're going to get their school shoes at, Asda or wherever. And that's sort of like, you have to have top down and bottom up. I think you need different scales. I mean, when we're talking about an individual family's well-being, of course, you don't want decisions made for them. People need to be able to make their own decisions and have their voices heard. But I think there's also, how we regulate business, for example, is another it's sort of like a different scale. It's that systems thinking, which I think you're much better qualified to talk about than me, Laurence. But yeah, I think that systems thinking is important. So to avoid inequality at the bottom, you've got people being able to make their everyday decisions and feed into things, but with bigger system change at the same time.
I think what I just added, obviously we all sit in a geography department, and as geographers we always think about what does geography bring to the table. Well, one of the things that we're very interested in is scale. So I think thinking about scale is important as well, that I'd add to that.
Just very quickly, two words that spring to mind are efficiency and innovation. Usually when you can find a better way of delivering something with less waste, it's often more profitable as well, and often less waste and less means less emissions, less energy usage along the way. If we think about Novo Nordisk or Eli Lilly making GLP-1s for people to inject themselves with if they're trying to lose weight, what are the wastages in that system in terms of transportation, in terms of the use of the plastic, in terms of all these things? If we can get that down, business benefits by saving money. It also benefits the environment by reducing carbon emissions, and it also benefits the consumer in many cases by having a more sleek, efficient product that delivers the care more efficiently. So,
yeah, absolutely. Any other? Yeah.
This lived experience is really important, but there's also an educational role in people understanding where their lived experience fits in. One of the paradoxes I've been sitting here thinking about is the more green spaces argument, but then somebody raised the safety issue and how you get a green space that is safe, but actually is a green space unsafe, and where are the facts on which people are making these decisions? Does that make sense? We have our perceptions. Again, another anecdote, I cycle a 15-mile round trip to work every day. Released to do that after I stopped doing the school run in the mornings because it wasn't possible to do it with 2 kids on the back of the bicycle in those days. My colleagues in the village cycle 10 miles on much more dangerous roads because they perceive the open spaces I prefer to cycle through to be unsafe. As far as I'm concerned, the unsafeness would come that if I did fall off my bicycle, it would be 5 minutes before a car came to pick me up instead of 30 seconds. But the chances of me being knocked off by a car doing 60 miles an hour when I'm cycling at 10 are infinitely smaller on the short route. I don't know what the answers are, but I've made my choices. But I'm a bit worried that quite a lot of lived experience is through the lens of not knowing. They know a lot about their lived experience in the precepts in which they live, which may or may not be factually accurate.
So I wonder if there's a difference between like individual decision making and being able to make decisions on how you take things, for example, like which route do you want to go, versus decision making about how, for example, green spaces are managed.
But that comes down back to the how green is green enough, and the green space that's managed with streetlights all the way along it and absolutely straight roads and no trees within 50 metres of the cycle route on each side in case somebody jumps out in front of you isn't the green space from which I derive the pleasure. But that's my perception.
Yeah, so lots of people having different ideas, and when you have too many voices, how do you get something that works for everyone?
Something that works for enough people to make it beneficial. I mean, this is all about risk benefit, cost benefit. I suspect can't be perfect for everyone.
I mean, I'd see it slightly differently because I think, if you go back to the sort of the slide with everything on it, a lot of the stuff that we're seeing in this data from this project is it's invisible. These things that matter to a lot of these families are invisible. So it's not a case of a sort of a one size fits all and taking this lived experience. You can't possibly do that, take everyone's lived experience and then translate that into something. But at the moment, a lot of those, that invisible labour of what it is to even care and move in the first place, not just for SEND families, but for, families, care is still very gendered. It's mainly women who are doing a lot of these journeys. A lot of that's invisible, and it's certainly invisible in a lot of the policy spheres. And I think for us, it's like saying, well, actually, these things may seem like very mundane things, but actually they really matter. And
I'm not denying that they really matter. It's what's invisible and what's perceived as being visible, and not always lining up that worries me a little bit.
I mean, certainly living streets, for example, who've sat around some of the things that they're like, we'd never thought of that. So again, I'm just using that as, I'm refracting a lot of it through this project because it's very fresh in my mind at the moment. But I think it is about making some of these things visible. And then what happens with that is again, I think the question that you're asking, that's a different question.
Hi, Federica Lucivero, Ethox Center. I wanted to go back to the question of cost benefits or co-benefits. As you framed the question is like, okay, how do we deal with, issues around kind of low carbon solutions as well as, as compared or as how do we weigh them against like issues around quality of care and access to care? And you brought up the point of co-benefits, and it's like, okay, we can do them all if we focus, for example, on efficiency. But as you said before, there are some issues that are less quantifiable, like if you think about kind of biodiversity and so on, which much more complicated. And that's why, very often we frame the question as net zero or low carbon, because that's the easiest way of getting into this kind of quantification of cost and benefits. But we know it's complicated, but I just want to think about this issue, how we frame it so often in terms of co-benefits. And the problem is when these co-benefits are not possible or where they don't happen, right? And I think it's a very uncomfortable, because I've been hearing so much talking about co-benefits, and I'm just like, okay, fine. But shall we talk more about those situations where we don't reach, when it's not that easy, when efficiency is not the solution for both? And I think that are very important conversations to have. And just as a background, I do come from philosophy background, ethics, and I'm just wondering, it's like, okay, do we have to be in these situations and explore even more the situations of conflict and tensions, because actually they allow us to really ask questions about what is important in this context, and also like going back to the lived experience aspect, like realize that sometimes it's not a one-size-fits-all solution, and actually we need to make some sacrifices. And I think as society in general that explore these sacrifices is also a society that's more aware about what is important and what are the values. So I don't know what the question is, to be honest. It's a comment, but I just wanted to bring kind of the discussion also on this aspect, that sometimes co-benefits are not possible. And it's okay. It's okay to have that discussion as well.
Yeah, look, thank you. It's a wonderful set of observations, and I wish I had a really succinct way of answering your question, but I don't. I think, this idea of shared value creation and cooperation, it doesn't always work out as planned, does it? And I think you've sometimes just got to be realistic rather than idealistic, and there's going to be winners, there's going to be losers sometimes, and life is not fair, the world is not fair, things don't always work out as planned, and you've got to be realistic about that happening sometimes as well. And there's not always going to be efficiency gains and healthcare gains and environmental gains. And you've got to accept the bitter as well as the sweet. And we've got to make mistakes along this journey as well. It's not going to be an upward trajectory of, sunshine and butterflies. We're going to go backwards sometimes. We're going to go forwards. Business is going to make mistakes. It's going to learn from that. We're going to move along the path together. So I think, it's a great set of reflections that you make.
Yeah, so I was thinking about, in terms of, yes, not every solution is going to suit everyone, and where you get those points of conflict, it does show what's important to different people. And I was yesterday reading a news article about parts of Scotland that have very low tree canopy cover, and we've just heard from Pete about the importance of tree canopy cover. And the comments, oh my gosh, it just made me feel so sorry for anyone who works in local government, like the county councils trying to make decisions that keep we live in increasingly urban environments with lots of people in the same space, and I think it's, you're never going to make everyone happy, and I think it's really interesting to think about looking at those points of conflict. I think it's really important, and I will definitely take that away and think about that.
And I think there's something more generally about care, and how care. One of our things that come up in these advisory groups around what it is to be a better stranger, and that's not because encounters with SEND children or anyone with neurodivergence or SEND or whatever you want to label it, encounters with people out in public, that can be a problem. And better strangers, that goes beyond, we can all be better strangers. And so I think there's something about care that sort of, I'm not just saying that because I work on care, but I think there's something about care that feeds through a lot of the things that we've been talking about thinking about how we do our research, the care that we put into our research or our work as policymakers or practitioners. And I think it goes without saying, everyone in this room, probably that informs their practice of preaching to the converted. But I think there's something significant about the care bit. And I'll leave it at that.
That might be a good point to end this first panel session on before we move to the second. Thanks so much to Jennie, to Laurence, to Martha for a really fascinating, sort of thought-provoking sort of presentations and discussions on the interdisciplinary aspects of this journey that we're all on to try and move towards sort of low carbon and biodiverse futures for health and care. And then we'll pick up the health and care themes in particular in panel 2. So thank you very much. Yeah.